Good afternoon, everyone, or some folks might be morning. My name is Dion Dobbins, and I am the Senior Director of Research here at Child Care Aware of America, and we're delighted to have you join us here today as we do a member webinar about our new Cost of Child Care report. Today's speakers, we have a great lineup for you today. Of course, you'll have me, but you'll also be joined by my staff, Jess Tersha, who's our Director of Research, and Christina Haney, who is our Data Analyst at Child Care Aware of America. We also have Jen Bump, who many of you know. She's our Senior Advisor at Child Care Aware of America and has been involved a lot with the CCR&Rs and doing the IGNITE study. We have Lauren Robertson, who is our Digital Advocacy Manager, and she's going to be talking with us about advocacy and how you can take this information and use it in your communities. We've also got some special guests, Melanie Brosson, who's the Executive Director of the Louisiana Policy Institute for Children, and Steve Rohde, who is the Deputy Director of Resource and Referral Services at the Maryland Family Network. And they'll be sharing with us some interesting work that they're doing in their states. So today we're here to give you a sneak peek of the overall report and share some key findings with you. And since you're a member, you'll get a chance to review the embargoed report before the general public. So we're asking for you to look for it in your inboxes before the weekend. We're excited to share with you the 12th edition of our Cost of Care report. And as you know, we talk more about prices. In this report, we talk about a lot of things. We see this report as an important opportunity to share with you and with the general public about the families and children that we serve, their concerns and their needs, and the way the public funding systems are set up to serve children's child care workforce issues, and why it's important for us to have quality, accessible, and affordable child care. In general, we know that families and single parents are still struggling to afford quality child care, and they're looking for solutions. This year's report summarizes the cost and affordability of child care, as we usually do, and provides an overview of the landscape. And then we also provide some strategies that states and communities are using to help parents afford child care. This year we have a special section about the role that CCR&Rs and other statewide systems like CCR&Rs play in helping and how they're poised to help communities, families, and providers access quality, affordable child care. This is really new information, and we're really excited to share it with you because it's from interviews that many of you participated in last year. This year, we also continue to do some deeper analyses, and we're including county-by-county analyses of child care costs in 10 states. Each year we try to do a few more, and this year we were able to get 10 states to partner with us. And we're introducing some cost case studies with you from some of our member partners. And finally, we'll share some solutions that are happening across the country and some policy recommendations. And we really try to use those policy recommendations and have them aligned with our policy agenda that comes out every year. In general, we know we're at a critical juncture. In a couple of weeks, we'll be headed into the midterm elections, and it's a really important time for us to elevate the role of child care in the child care system. We need the new congressmen and congresswomen, media, and parent attention. And it's time for action, time for solutions, and time to really spur on the policy and state change that we're looking for. First of all, did you notice that we changed the title this year? This actually came from a suggestion from one of our members. So in the past, we focused our title on parents and the huge role that they're often made to play in paying for care. In fact, even when you look at the National Academy of Science and Engineering and Mathematics report on the financing of child care systems, it called out the fact that the child care system relies very heavily on parents. But they suggest that parents should not be and cannot be expected to bear the brunt of the cost of child care. It's just simply not sustainable, and in the end, we all know that public financing is what is needed. So this year, we wanted to kind of look at this issue and think about the fact that costs and fees aren't just the things that parents should worry about. It's an issue that we're all part of solving. We use the word US, or we use the word us, and it's also part of the word for United States, but we were playing on that word to say that it takes all of us, in quotes, to solve this problem. The unaffordability of child care is a problem that not only affects families, but businesses and the economy, and it takes all of us to fix it. And it's not just the fact that we're looking to fix the cost to parents, but the cost to the system that includes the professional development, the workforce, and CCR&Rs and other systems and at the state and local level. We'll get into some details with the rest of the research staff in a few minutes, but in general, some of the key takeaways, and you won't be surprised by many of them, but we're basically saying that quality, accessible, and affordable child care benefits families, states, communities, businesses, and our country. We know that it's affordable based on our unaffordable based on our analyses in all of the states plus DC. We again brought out the national average calculation, and that cost for child care at the national level, when we do our different averages, is about $9,000 a year. But I think the actual dollar amount isn't as important as the fact that it's really about 11% of a family's income if you're averaging across the country. One of the other things that we're really trying to push, and we'll continue to push every year, and hopefully we can do more and more, is the fact that child care costs and affordability is really best understood when we examine it at the local level. And the deeper we can get into the local level, the more we can understand how we can support and help families and communities. And of course, our big message is that childcare deserves public investment. And it's for a number of reasons, but we want to make sure that Congress is fully funding CCDBG and other funding sources. We want to make sure that we can further engage CCR&Rs and members like you as thought partners and as implementation vehicles. We want to make sure that whatever comes out of this public investment, it's shifting the burden from parents to all of us and to the different systems that can be involved. We really want to make sure that it's not just about thinking about cost, but also the availability and the supply of quality care so that we have affordable care for all children. And we know that without a workforce that's supported and that is sustainable, we can't even think about having affordable child care. So we really want public investment to go to build and support the workforce. So as I mentioned, this is our 12th report, and we are now as an organization over 30 years, because I think we were founded in 2008, and this is our 12th report. The data we summarize in the report is available. All of the full data is available in our appendices, and we have tables that include state rankings for affordability by age group, affordability as it compares to a number of different household expenses like tuition and mortgage and rent costs, as we typically do. And then we also look at child care costs as it compares to providers' salary. We have regional case studies this year from Maryland and the DC metro area. We have a lot of information about what's happening in Louisiana. We've got some maps from California, and in Vermont we have a really nice case study around businesses. Our interactive map has been updated with this year's data, and it's complete with some really nice print-friendly PDFs that you can take away with you when you're trying to do some advocacy work or trying to explain what's happening in the state, in your state. We've updated our parent tip sheet so that it includes new links that are associated with our consumer education work that we're doing and the new website. The information that we'll be offering helps families seeking high-quality, affordable child care, and it's something that is, it's like a one-pager or two-pager, really simple and easy to use and understand by parents. And also, we want you to check out our social media toolkit, and I think it's really helpful. It's got tweets and Facebook posts, Instagram posts, simple email language that you can use to share the report, some customizable things. And finally, we'll be releasing a special county level supplement after the holidays this January. On Monday. On Monday, I'm sorry. I have my notes say January, but it's actually on Monday. And you can find, right now, you can when we do launch it on Monday, you'll be able to look at also the county level data in the interactive map. And you'll see like some high level, county level analysis for some select states, 10 states. So I know I'm preaching to the choir when I share this slide, but I think it's critical to set up the point and reiterate that child care not only affects parents, but it affects everyone, especially business and the workforce and in our communities. And we feel like these are points that we always come back to when we're trying to set up the stage, when we're talking to politicians, parents, advocates, everyone. We always kind of come back to these kind of key points. And we want you to think about these points and keep them in your back pocket as well. And you can use our report to help you make the case. As you're probably aware, there are so many states now doing the economic impact studies on child care. And we highlighted some of them in our report. And we actually have people from Maryland and Louisiana who led the way in that work on our call today. We're looking forward to a national review on this topic from Ready Nation, and that I think is coming out next month. So we know you as our members get it, but we want to share it with everyone else. And I encourage you to read the section in the report about the child care landscape and about the most vulnerable populations with respect to access, quality, and affordability. This year, as I mentioned, we have the opportunity to highlight state-like structures like CCR&Rs that can support the child care system. And we really make sure we call out the fact that if these structures are fully funded, they can really help with some of the solutions needed in this issue. I'm going to turn it over now to Jennifer Bump, who will share with you some of the findings from our Ignite initiative this year. And she's going to highlight how, in general, some CCR&Rs are a great vehicle to help parents, communities, and business with child care costs. And I just want to remind you, she's not going to be able to share everything with you, but please check out that part of our report. So I'll turn it over to Jennifer. Jen Bump, thank you.
Thanks, Dion. Hi, everyone. Good afternoon. We are so excited to include a new report section that does focus exclusively on the role of CCR&Rs in addressing child care financing and affordability. The goal of this expanded section in the report is to compel policymakers, government administrators, private sector stakeholders to view CCR&Rs as a primary thought partner and implementation vehicle to systematically address child care financing and affordability. The report emphasizes services for families and providers and communities and the synergistic relationship that is played when all three of those stakeholders are served by CCR&Rs. It's that synergistic approach that provides a unique infrastructure in which innovation and public-private partnerships can be fostered. The intent of this section is really to highlight how CCR&Rs work in that way and the opportunities that follow. We highlight CCR&R's historic and inherent relationship with the Federal Child Care and Development Block Grant, our nation's most significant investment in child care, and offer insights into how states and communities can partner with CCR&Rs to more effectively address the nation's child care financing crisis. You'll see that the report is infused with extensive data about CCR&R services, as Dion mentioned. The data selected to share is intended to give both a baseline understanding of what CCR&Rs do and how they do it, but also to emphasize those services that CCR&Rs perform which effectively address affordability and financing. Finally, we include several specific recommendations that address the need for targeted public investment in the CCR infrastructure to achieve maximum impact at the local, state, and national levels. Next slide, Dion.
So I'm going to turn it over to Christina, who will share with us some of the big pieces, the key findings, and tell you a little bit about our methodology.
Thank you. So yes, I'll talk briefly about the methodology that went into the report. Every year we release an annual survey that we use for both our state fact sheets, and we also collect cost data at that time. We ask CCR&Rs and government agencies that collect data on child care to provide us with the annual cost for both center-based and family child care for infants, toddlers, 4-year-olds, and then if they have school data, such as before and after school programs, part-time summer and full-time summer. And then, so we collect that data from yourselves, from CCR&Rs and government agencies. We also supplement it with U.S. Census data. We look at things like the median household income for married couples with children and for single female householders with children. And then that's what we use in order to calculate the affordability. So we'll take the annual cost and divide it by the median income for married couples and then also the median income for single parents with children. And that's how we get the percentages that you'll see in the report. And that's how we know, like, for example, that child care will cost a family 11% or et cetera. If we did not receive state fact sheet survey data from a state, then we will use the prior year's data and adjust it for inflation. So I mentioned that we collect median income data from the U.S. Census. We also collect things like mortgage and rent, like average mortgage and rent data for each state, so that we can use that as part of the appendices. when we compare the cost of childcare to the average annual cost of mortgages or rent in a state. We collect also data from the Bureau of Labor Statistics on the childcare workforce wages and also on regional household costs. So for things such as transportation and food, again, we can use those comparisons, or we can use those costs and compare them to the annual cost of care, of childcare. And then finally, we look at, we collect data from the College Board about college tuition and the average in-state tuition, so that we can again compare those costs to the cost of childcare. In our appendices, you'll see things like average state costs, rankings based on those average state costs, the affordability for both married couples and for single parents. We also look at costs for those at who are at the federal poverty level, at 150% and at 200% of the poverty level. And we also look at how affordable childcare is for those who actually work in the childcare field. So those are just some examples of our appendices.
Thanks, Christina. This is Jess Hirsch. I'm the Director of Research at CCAOA, and I just wanted to share a couple of updates about that national average number that we began calculating for the first time last year. I'm not going to go through the methodologies, but did want to point out a few things about this number for this year. As you'll see, the percentages for the amount of household income that go towards the national average cost of childcare are a little bit higher than they were last year. And I wanted to take a second to clarify what that means for folks, because I'm sure that there will be questions about this as people start reading the report. While this is not necessarily an indication that childcare costs are increasing, it is a reflection of the data that we were able to collect from states this year. As noted, approximately 11% of the median income level for married couples across the U.S. We're estimating does go to cover the cost of childcare. The key takeaway for this national number is that childcare is unaffordable nationwide. We've included one of the tables from this year's report on this slide, just to give a little bit of a flavor for the variations by age group, as well as by childcare setting. We wanted to be able to show folks a little bit of the numbers that go into that national average, again, for each of the methodologies that we use, which are an average of averages as well as weighted averages. So we wanted to take a second to address that, and again, to just reiterate that that national average is an indicator that childcare costs are still very unaffordable for families across the country.
And so, like we did in previous years, we will have a cost of childcare map that will be available on the website in conjunction with the report. And so, the map that you see on the slide, the colors correspond with the average, what percentage that a married couple family can spend for infant center-based care for infants. And so that could range anywhere from 7% to over 12%. And so clicking on a state will take you to what you see on the left-hand side of the screen, where you'll see more robust data on things such as infant child care costs in a center as opposed to in a family child care center, and then also the cost for 2 children, an infant and a 4-year-old. We calculated those costs as well. Toward the bottom of the page, you'll see, again, a comparison between center-based care and family-based care for infants and also for 2 children. And then we also look at college costs compared to the cost of infants or care for an infant in a center. So at the very bottom, you'll see a download this data, that green button, and if you click it, you will get a PDF that you see on the right side. So you can, this could be helpful for you in your advocacy efforts or just for your own information. A lot of the data that is on the left-hand side will also be on the right-hand side. It's just a little bit more graphically appealing and user-friendly. And so, as Dion mentioned, we did county-level mapping for 10 states this year. And so if you double-click on these states, you will see you can get county data that's similar to the state data that I just talked about. And so it'll break down costs by county. And then, again, as Dion mentioned, this county-level supplement will be available on Monday. And what it is basically, we looked at all the different costs for infant care and also for 4-year-old care at the center and family child care providers. And then we also, we calculated affordability based on median income like we did for the state level, but we also compared county level affordability to state level affordability. And so if you see in that pink column, if a number is positive, that means it is, that it's more expensive at the county level than it is at the state level. And so, we do the top 5 for each type of care, and then on the subsequent pages, you'll see every county and their different affordability rankings. Great. Okay. And so, an obvious statement is that childcare is a major household expense if it's costing a lot in terms of median income every year. We examined childcare costs versus housing. So we looked at average annual rent payments and also average annual mortgage payments. And we found that center-based childcare for 2 children, so for an infant and a 4-year-old, can surpass an average annual mortgage cost in 35 states plus the District of Columbia. And so it's, you know, in these states and in DC, it's more expensive to send your 2 children to daycare or childcare than it is to pay for your annual mortgage. We also found that we looked at Bureau of Labor Statistics data for all 4 U.S. regions, the Northeast, the Midwest, the Southeast, and the West. And we found that when we looked at the annual cost for center-based infant child care, it outpaced transportation and food costs combined in all 4 of these regions. And we also found that child care is unaffordable for those who work in the child care field. The median salary for child care workers in 2017 was a little over $22,000, and that breaks down to about $10.72 an hour. And when we looked at child care workers who have to send 2 children to child care, we found that they have to, in every state, they have to pay at least half of their salary to cover the cost for their 2 children. And a few months ago, in conjunction with the Center for the Study of Child Care Employment out of UC Berkeley, we created a video called "Why Do Parents Spend So Much But Providers Make So Little?" And the goal of this short video is to try to explain to the general public why they have to pay so much for child care, and yet those who care for their children make so little every year. And so I think we've gotten a very positive response from this video, and I think it really breaks down why it costs so much.
Yeah. And just as a reminder for folks who haven't seen that video yet, it is available on our website through our newsroom, as well as on CCAOA's YouTube page. And if anyone needs help finding it, please reach out. We would be very happy to share that with you. So the sum of all of those statistics that Christina just shared with us is, of course, as you all already know, childcare is unaffordable for all families. And Lauren, our advocacy guru for today, is going to share a little bit more about all of the ways that you can help get that message out. But I wanted to show a couple of graphics that are available in this year's report and that you're able to share. And again, point you towards those customizable graphics that we've made available for the last couple of years. And again, you are able to customize those with key messages, findings, and stats specific to your state to share out a little bit easier. And with that, I'm going to introduce Melanie Bronson, who's joining us today from Louisiana, and who is going to share a little bit about the work that they've done, particularly around their economic impact study from, I guess, about a year ago now. Melanie?
Thank you. Hi, everybody, and thank you to Child Care Aware for all your great work that we on the ground so depend on in our advocacy. down here, but and I know across the country. Our Losing Ground report, and we're titling this Gaining Ground just because I'd like to think from the advocate perspective, we're gaining ground with the Losing Ground report. But it was a report that we did, as you mentioned, I think it's actually been 2 years now, or a year and a half. It was really part of work that we were doing to try to organize and engage the business community across our state. We had created Early Childhood Business Roundtable, but found that we were having trouble having the business community get as much as they understood the long-term effects in a state like ours that's very red and always seems to be in a financial crisis, to get them to prioritize funding early childhood was difficult, with the sense that we don't pay for that. We weren't paying for that immediately to their pocketbooks. And so I was struck when I looked around both locally and nationally, the lack of data on the effects of childcare breakdowns on the workforce today. In fact, Childcare Aware had a great toolbox on it, but basically, I think y'all were looking at the one study we all were looking at from 2005. It was very outdated from Cornell, I think it was. It was just that was it. I mean, there's just about nothing on it. So we finally gave up trying to find it and just created it ourselves. In a little study that we did at the state level, where we hired LSU, Louisiana State University, to do a survey of parents of children birth through age 4, asking questions about the workforce and the effects of childcare issues on working. And it was really cool because I was going to ask just questions like what had been done that one study before about actually missed days and being late to work, because those are easier to put a price tag on. And we also had an economist who could put a price tag on it. But my business members said also ask questions about workforce participation. And I am so glad we did, because in many ways, that's the bigger story. So we did find, and so then, as I mentioned, we did this survey, and then the economists put a price tag on it. And we did find that over 40% of both men and women, and that was not different, statistically significantly different for us, missed work at least once in the previous 3 months because of childcare breakdowns, and similar statistics around being tardy or leaving early. But to me, what was even more interesting was the effect on workforce participation in terms of the percentage. 17% of both men and women reported quitting a job because of childcare breakdowns. 14% had turned down a promotion because of childcare breakdowns. 18% had gone from full-time to part-time. And I'll just mention this, we did not emphasize this in the report because at that time, politically in Louisiana, we didn't want it to become a woman's quote-unquote issue. But the statistics for that are even more incredible when you look at women. So women versus men, 2% of men versus 15% of women reported quitting a job due to childcare breakdowns. 12% of women versus 2% of men reported turning down a promotion. So, I mean, when you start looking at the effects of these figures, 15% of women versus 3% of men had gone from full-time to part-time. So when you think about a woman's trajectory and all those issues, women's issues, it really is pretty stunning, the effect of this on women's workforce participation and climbing up the ladder for women. So anyway, we did this report, and I was stunned by how quickly it took fire nationally and was noticed. The U.S. Chamber, just a few months later, put out their report on the importance of childcare for the workforce, and they quoted our report. And then Maryland, which is on the phone today and will give you their version of this report, quickly followed suit and did it. Georgia will be coming out with their version of this at the end of this month. And as was mentioned, next month, Ready Nation has now done this at the national level, and they'll be releasing their report at the national level next in November at their meeting. They did birth to 2, so they were really focused on the infant toddler piece. But to me, it is wonderful and very exciting that we're finally shining a light on this. It has been incredibly effective in my state in terms of chambers adding this to their education platforms. Our state affiliate of the U.S. Chamber has now made early childhood education a top priority. Not to say the U.S. Chamber, wasn't the only reason they have, but whenever they talk about it, this issue, they talk about it quoting this report. And in fact, the media has picked up on it to where they rarely talk about early childhood education they often don't say it's this report, but they're quoting the data from this report just anytime they discuss child care assistance, which we are pushing very hard to increase the child care assistance, the number of slots in that. I forgot to mention that we put a price tag on it, which was very compelling as well, so that we found that there was an annual loss to our employers of $816 million a year because of child care breakdowns, and over $1 billion loss to just the Louisiana economy. So those figures also were very compelling for the media and for businesses. So that's been our work around that report. Y'all had also asked, I think, for me to talk a little bit about the cost modeling work that we're doing right now, and I can spend a second on that if you'd like. I didn't know if you had questions or anything about losing ground, but you'll hear more from Maryland about that and their work on that. Yeah. I can talk about the cost models real quick. We are doing work with our Department of Education on cost modeling the cost of care in Louisiana. And what this is about is our infant toddler rates are very low. We've recently increased our rates for child care by 200, child care subsidies, for the child care assistance program, by 250%. They were so low and so bad that we went up 250%, and we're still one of the lowest in the country, but at least we got a huge increase. But what we didn't do was make much of a difference between infant toddlers and 3 and 4-year-olds. So our infant toddlers are only paid $1 more a day than our 3 and 4-year-olds. And so this is what we are pushing on. And we engaged our Department of Ed. They were very interested in looking at this, and we're working with Louise Doney, of course, who is the mother of these cost models. We actually are changing her cost model, doing it a little differently than she did it, but she's helping us so that we can feel comfortable with it. But we're honing in on the cost of quality care. That, to me, has been such a missing link, that most of us are looking at market rate surveys, and of course, Child Care Aware, that's what we're going to as what we're looking at. But at the end of the day, if all we're funding is low quality, how far are we getting? And we have a system now where all publicly funded child care centers, which is all the ones that are willing to accept child care assistance, have to be part of our rating system. So if we're funding them at a level that won't support the quality that we're demanding, then we're just setting them up for a low rating and basically setting them up for failure. And I think, in fact, that's what we're doing. And so what these cost models are helping us do is show that. And they are, of course, showing that, as you can imagine. And we're only getting data and information from the higher quality centers, the centers that are rated proficient or above in our rating system. The other piece of it is that it's showing some sort of overall things that I think we all know, but can inform policy, which is enrollment rates significantly impact the cost of quality care, and center size significantly impact the cost of care. So that to the extent it's possible that our policies could help with those two issues, in the way we fund, then we know that could be very important. So that's our work in Louisiana. Thank you.
Great, thank you, Melanie. So next, we would like to introduce Steve Rohde. Steve, just a second. I'm going to unmute your line so you can share a little bit about what's going on in Maryland. Steve?
Hello, can you hear me?
Yeah, we can hear you now.
Oh, great. What's going on in Maryland? How much time do you have? Well, first of all, I want to give a huge shout out to Melanie. Melanie was very gracious in sharing the information they did in their original study, and we were able to replicate and expand the study in Maryland. and it gets people's attention. And as Melanie was talking, I was thinking, you know, it's really interesting that we're doing this kind of work now, because when I came back to Maryland a little over 20 years ago, this was the emphasis for R&Rs, where they were making the business case for childcare, and they were helping businesses look at childcare options, and the pendulum seems to have swung, although fortunately we also have a lot of information now on what quality early childhood education, to pick up on Melanie's theme, what quality education means in the long term. And what Melanie and Louisiana's work helps us to do is also to get people what it means in the short term in terms of helping parents go to work, helping parents to be productive, and helping employers do what they need to do. Melanie, there's one other thing I'm not sure if you're aware, I didn't hear you mention it, is Indiana also recently came out with a version of this. And if you're not aware of it, Melanie, let me know and I can send you the link to this. So as Melanie indicated, we've also gotten quite a bit of interest with this particular approach as well. And it's really sort of reinvigorated how we look at having such information for a public policy outreach. Now, Maryland has what's called child care demographics. We do one for each of the 24 jurisdictions in the state of Maryland. We have 23 counties and Baltimore City, and then we do one for the entire state. So we do this on a broader scale. But what we did was we had the opportunity with Child Care Aware of America this year to look at two jurisdictions that are, if you're not Washington-centric, traditionally have been at the heart of Maryland policy and politics, and that is Baltimore City and Baltimore County. And what the focus Child Care Aware of America helped bring to this is to look at two adjacent jurisdictions to talk about the similarities and differences between the jurisdictions in terms of population and income, but then also to highlight how there are great distinctions in terms of how much people pay for childcare and that type of thing. I want to also add that we're looking to try and do a little bit more in terms of the policy work. So one of the things we recently did, and I'm sure other states are being asked to do this as well since this is coming down from the feds, is to map non-traditional care and where non-traditional care is and where it isn't. And that's been very interesting. We did some work for the state on that. We've not heard back from the state in terms of what they're thinking of doing, but it's gotten us involved in conversations that, again, historically we've been involved in, but given that there's been a changeover in the leadership recently, we haven't been involved in. So we're very much looking forward to the report coming out for us to get some traction, as well as Child Care Aware of America, and to really broaden, again, back to the economic piece of this and the importance of it, parallel that with the approach about what investment in early childhood does, both for the short term in terms of child outcomes in school, reduced remediation rates, those sorts of things, as well as the very immediate piece in terms of how it helps parents, how it helps families.
Great, thanks so much for joining us, Steve.
Thank you.
Okay. As Steve mentioned, we did get to work with Maryland Family Network on a regional examination of the affordability of childcare across that region. And of course, I highlighted the other two studies in our slides today. And I'm just going to give you just a quick sneak peek at the some of the mapping that our awesome GIS team has done with a couple of other folks as well. Here you'll see just a snapshot of some mapping that we did on the county level examination of the area surrounding DC, both on the Maryland side as well as the Virginia side. And I will emphasize that this is county level, so keep in mind that, of course, we would expect that if we were able to drill down a little bit deeper to zip codes or neighborhoods, that there would be a lot more dark blue on this map. So keep that in mind when you check out these case studies. As I mentioned, we worked closely with Steve and his team at Maryland Family Network on a Baltimore City and Baltimore County map that is in the report, as are these snapshots. And we also worked with the Child Care Resource Center in California on maps on LA and San Bernardino counties. We actually worked closely with their mapping team. They did a number of maps for us, which are available in our report, and they are also linked to our report, so you can check out all of their wonderful work as well. For the DMV map, of course, we got information from Maryland Family Network as well as Child Care Aware of Virginia. And we also included updates that Melanie and her folks in Louisiana were able to help us with, as well as a really interesting case study in Vermont. So definitely check those out in the report. We've updated some of the possibilities as far as financing solutions. I'm not going to go through them now, but of course solutions include those economic impact studies that we're really excited to see coming out of states. Estimates on the costs, you know, as Melanie talked about, it's really important to understand not just what the prices of childcare are, but what the cost of delivering really quality childcare is, so that we can work on, you know, making sure that the workforce is compensated and supported, but that we're also investing in childcare. So we reviewed a number of solutions, and we did our best to include mini case studies and snapshots of work that we know is going on. But of course, we also know that there's a lot that we don't know that's going on. So as you read the report, if you know of some of those innovative things going on in your community or in your state, we would love to hear about that. We would love to elevate those stories throughout the year and make sure that others are aware of some of the possibilities as they are looking for their own solutions to finance quality child care. In addition, we were really excited about the report that came out of the National Academies of Sciences, Engineering, and Medicine, the Transforming the Financing of Early Childhood Education report. And we thought that there were some really interesting recommendations that we tried to link to some of the solutions in our report. We really felt that this was an opportunity to kind of bolster those solutions and promote them, particularly, you know, since those recommendations came from NASEM. We thought that that would be a really helpful addition to this year's report.
And then finally, we tried to provide recommendations in the report that focus both on what needs to be done at the national level with Congress, but also includes what parents and providers and professionals can do in terms of advocacy. So they kind of, there's a lot of them in the report, but they kind of come together in different categories. Of course, we're going to ask for investment in child care. So we want to really talk with our lawmakers about investing in crucial funding structures. So that means making sure that we're maintaining strong federal funding for states to fully meet the needs of CCDBG and meet the laws for CCDBG, but also some of the other funding sources that can support child care, including TANF and SS,
SSDBG?
Yes, SSDBG.
Okay.
Yes. We also really want to make sure that we consider all the different types of funding that are important. So funding for quality, funding for professional development, infrastructure, and funding to support this critical statewide infrastructure that we highlighted this year, the CCR&Rs. We're really concerned about making sure that there's funding to support working families. There's an act that is out there called Child Care for Working Families Act that ensures that families that earn less than 150% of state median income pay more than 7%. That they don't pay more than 7% of their income. We want to make sure that there's family-friendly funding sources or supports for families. So we are encouraging folks to look at the Family and Medical Insurance Leave Act, which allows parents to spend more time with their children when they're young without sacrificing their career, and seeing that as a way of thinking about child care. without having to be part of the system as well. And then finally, like, I'm really concerned about student-friendly funding sources, and one that we know needs to be a permanent solution and be reauthorized is the Child Care Access Means Parent and School Readiness School Reauthorization Act, also known as CAMPUS. We are very concerned about providers and making sure that we prioritize the child care workforce and make sure that not only are they paid well enough, but that they can afford child care for their own children. So really thinking about how we can support the educational system for the workforce, ways to support those providers through CCR&Rs and other structures, how we can target technical assistance to these providers. We want to make sure that both our lawmakers and our communities explore innovative models to reduce the high cost of burden to child care providers. And then, of course, we want to think about how we can improve the compensation across the country for the child care workforce, and that's definitely going to take public investment. We're very interested in subsidies and the fact that many children who are eligible are not receiving those subsidies at the state and the local and the national level. So we'd like to figure out or advocate for ways to streamline those eligibility standards. One way of doing that is there's the Promoting Affordable Child Care for Everyone Act. That's the main focus of that act. We want to talk about making improvements in child care subsidies that are provided under TANF so that the TANF regulations line up with the 12-month redetermination period that's set up in Child Care Development Block Grant. We're interested in hearing and learning and thinking about how states are reducing barriers to subsidy administration that prevent families from receiving assistance. We're interested in how states are looking at flexible sliding fee assistance and phase-out plans, and really concerned about families that are in the gap, so they don't quite meet the eligibility for child care assistance and maybe make too much or maybe recently receive salary increases and they're just in the gap. How do we support those families? As we can see throughout the country, it's just very hard for people to support at all income levels. And then finally, we're really concerned about supply and making sure that there's funding for pilot programs that explore strategies to meet the needs, especially in high rural areas or high poverty areas, or with children who are children of color and children who are in special needs populations, to really explore how people across the country are looking at gaps in supply and demand and working to support providers. And then finally, we're very interested in having funding to provide resources for planning and developing child care capacity to increase the availability of high quality options for working families. I'm going to turn it now over to our advocacy guru who will talk with us about, like, so what's the next step?
Thank you, Deanne. So our communications and advocacy teams have been working really hard at making this report not just a report, but ways that you can easily take action pretty instantly right when the report's released, and then some other ways to use this report as we enter the new year and the new legislative sessions post the 2018 midterms. So if you're not signed up already, we encourage you to join our child care works list and join the National Movement for Quality Affordable Child Care. You will receive action alerts and other updates, and we always include an action and an option to share in those emails, and we don't spam you. We send them when an issue is important and when we need your support. And as child care aware members, if you don't already have an action center in your state, we can get you one. So if this report gets you riled up and wanting you to take action and communicate more directly with your elected officials, an action center is a great way to do that and to activate your family advocates and child care providers in your state. So let us know, and we're happy to work with you to get an action center. And we talk a lot about contacting your members of Congress and talking about national and federal policy, but we also know that our local and state elected officials also need to hear from you and your networks. So we encourage you to contact your members of Congress and other elected officials. We have these really cute postcards that we'll be sending out in our emails It's something you can print out, color, write a letter to your elected officials talking about the impact of cost of care on you, on your families, on child care providers, and send them directly to them. We're also excited about this as a way to engage newly elected officials post-election. So we will be doing a bit of a second prompt, second push in the new year so that you have a way to engage your elected officials right as they start their new legislative sessions. And really getting them to commit to a plan for childcare and asking them what they are going to do. We have a great social press kit, social media kit that our social media manager has created that has direct, you just click on it and you can instantly tweet or share on Facebook with beautiful graphics. Jess also mentioned the customizable graphics, and we encourage you to share state-specific information as well, and because your audience is often in your own state, so they want to see what's happening at the local level. And on next Wednesday, we are having a Twitter storm at 3 p.m. Eastern using our hashtag #ChildcareAndUs. We have a bunch of sample tweets and easy ways to tweet directly again from our social media kit, and all these links will be in your inbox. I just want to add a note, if there are creative ways that you take action from this report at the state or local level, we'd love to hear it from you because we want to be able to share that on social media and also keep those in mind for next year, because we're always looking for ways to help our members and other advocates take action from this report.
Great, thanks, Lauren. So with that, we are just about out of time for today, but if you do have any questions, please enter them into the chat box. We might have time for about one question, but I also want to leave contact information for everyone at CCAOA up on the screen. You can also, I think there are a couple of avenues through the website where you can reach out to us. If you want to get a hold of the research team, an easy way to do that is research@usa.childcareware.org. I did notice that I have a couple of emails in that inbox this morning, but I think we've been a little bit busy with the report, so I will be following up if you are one of those folks. It looks like we did get a question. The question is, when will we receive our copy of the embargoed report, and then when will it go to the press? So the embargoed copy will be released to members before the weekend. It will be publicly launched along with all of those other things that we talked about today, the share kit, the county level supplements, the updated map, all of that on Monday, I believe Monday afternoon.
Also, a quick and easy way to remember how to reach us is it's our first name dot last name, and all of our, all of it after the @ is the usa.childcareware.org.
Oh, the question, the follow-up question to that is, so will reporters have it ahead of time? They also often call for background prior to the release.
I believe that there are a few reporters, I think they're mostly national level reporters that have, that are going to have embargoed copies that we've shared. But what we can do, and this is another name we probably should add to our PowerPoint, is Rayanne is our PR person who works directly with the press, and so we can connect you with, I think this is Ann, probably, who has connections with her anyway, but we can let her know that you have that question, and let her know also if you need to have conversations with her about specific parts of the report, we can get that to you. And I think what we're going to do in some of the emails that we send out, we are listing her name and her contact information, because she is available to help you at the state level and at the local level with any PR and media requests, even to the point, she said, of doing media training to help you get ready to answer questions.
Yeah. And on that note, just a quick follow-up from Adina, who is our awesome communications lead, that the public launch of the report will be Monday at 10 a.m. Eastern time, just as an FYI to folks. And it looks like we are out of time, so we are going to wrap up the webinar. Again, please feel free to reach out to anyone on our team if you have any questions, concerns. Let us know if you have questions as you read the report. And thank you all for joining. Thank you all for being so active, and for those of you who give us data, very much appreciated. On that,
Thank you so much.
Thank you.
Bye-bye.